Hello and welcome to Nikolai's genetics lessons, and today I have prepared very easy question for you. And here's a question: the causative agent responsible for 50% of common cold infections are the, and you have to choose one of these answers. If you don't know the answer yet, just in less than a minute you would know exactly what kind of virus causes over 50% of the common cold infections. Common cold, also called viral rhinitis, is one of the most common infectious diseases in humans. The infection is usually mild and improves without any treatment. Because of the large number of people who get the common cold, this illness results in more than 22 million days of missed school and even greater number of absent days from work every year in United States. The average American has 1 to 3 colds per year. The common cold is an upper respiratory infection that is caused by several families of viruses. Within these virus families, more than 200 specific viruses that can cause the common cold have been identified. The virus family that causes the most colds is called Rhinovirus. Rhinoviruses cause up to 50% of colds, and this virus family has at least 100 distinct virus types in this group. And probably many of you just wonder about coronaviruses, but coronaviruses are just number 2. Since there are over 200 different strains of viruses that can cause common cold symptoms, development of the vaccine for the common cold has not been possible. Rhinoviruses cause most colds in the early fall and spring. Other viruses tend to cause winter colds, and their symptoms can be more debilitating. There is no evidence that going out in cold or rainy weather makes you more likely to catch a cold. By the way, I forgot to say that rhino in rhinovirus stands for the nose. Now, maybe it would be much easier for you to memorize. And the common cold causes a group of symptoms that are easily recognized by patients and doctors. About 50% of the patients will develop a sore throat, which is often the first symptom to appear because it can occur as early as 10 hours after infection. This is followed by congestion of the nose and sinuses, a runny nose and sneezing. Hoarseness and cough can also occur and may last longer than other symptoms, sometimes for several weeks. Higher fevers are rare with common cold. Now you can ask how the symptoms differ from of the flu infection. And one of the signs would be congestion of the nose. When you have a flu, you usually do not have this symptom. Now about prevention. The common cold most often is transmitted by direct contact with germs from the nose, mouth, or coughed or sneezed droplets from someone who is infected, usually by hand-to-hand contact. Virus particles are passed from one person's hand to another person's hand. The second person then touches his or her eyes or rubs his or her nose, spreading the virus there, where the virus can start a new infection. It is possible to become infected by touching a surface such as tabletop or doorknob that has recently been touched by an infected person, and then touching your eyes or nose. These viruses also can be spread by inhaling particles from the air after an infected person has coughed or sneezed. To avoid getting or spreading a cold, it helps to clean your hands often, carefully dispose of all used tissues, and avoid rubbing your eyes and nose. If it is possible, you should avoid close, prolonged exposure to people who have colds. Usually about half of the family members of an infected person will become ill. Colds also are transmitted frequently in schools and daycare facilities. People who can get less than 7 hours of sleep per night are more likely to get colds compared to those averaging at least 7 hours of sleep per night. Also, people who exercise regularly, especially those who exercise daily have fewer colds per year than those who are less active. So now we can choose the correct answer, and you know that this is answer C, rhinovirus. Cause more than 50% of all common cold infections. And again, we cannot make a vaccine from rhinoviruses because there are too many strains. And this is all for today. Thank you for your attention. Please subscribe for my new videos that I post almost every day. And see you in the next video. Goodbye.